Hi, my name is Dr. Lynn Marie Morski. I'm president of the Psychedelic Medicine Association and host of the Psychedelic Medicine Podcast. And today I'm going to be giving you an introduction to psychedelic medicine. Now, what is psychedelic medicine? Well, psychedelic medicine is any therapy that includes a psychedelic substance. Now, very often these therapies also include a psychotherapeutic component. Now, unlike a lot of other medicines that we may be used to, very important components of a psychedelic therapy are preparation and integration. Preparation is what happens before a patient undergoes a psychedelic medicine journey, where they prepare both mentally and physically for the journey. And integration is what happens afterward, where you take whatever kind of insights you may have gained from the psychedelic experience and then work those into your daily life. Because you have to go back to work after doing this psychedelic experience. You have to go back to your family, back to your daily lives. And integration is the process that helps you incorporate what you learned into your psyche and practice these new patterns and new ways of being so that you can make the most out of the psychedelic experience. Now, psychedelic medicines are most often used to address illnesses and conditions that have trauma at their core. But this is changing. Now we're investigating psychedelic medicines for things that are completely unrelated to trauma, like stroke, or perhaps cluster headaches, or pain syndromes related to missing limbs from amputations. Another thing about psychedelic medicine that is unique is that psychedelics are very often aimed at getting the core cause of the illness. Like you hear about root cause medicine, psychedelics are a root cause medicine. Their attempt is to dive down, resolve the cause of the illness, not just treat the symptoms. Today we're going to be talking about some of the most commonly studied psychedelic medicines. For example, ketamine, which is currently legal in all US states, MDMA, which may be FDA approved as of August 2024, Psilocybin, which is in phase 3 trials, which is the last phase before a drug can go for FDA approval. And then we're also going to be discussing LSD, DMT, 5-MeO-DMT, Ibogaine, and mescaline. Now let's talk for a minute about microdosing. You've probably seen so much about microdosing in the news. It gets a lot of press because it's something that seemingly is much easier than undergoing a large psychedelic experience that requires a number of therapists and a number of hours in a therapeutic session. Microdosing is more akin to what we're used to with where every day we take some kind of supplement or medicine in the morning. And the issue with microdosing is that the results have so far been mixed on what trials have been done. So we have findings from a study out of Imperial College London that showed that microdosing worked if you thought it did, meaning that the placebo effect was very strong, but that there was no actual effect. However, new studies have come out. In fact, the study came out just in February of this year, showing some positive data for those suffering from depression with microdosing. So at this point, it's hard to say if microdosing is or isn't effective and what substances and what amounts might be effective. Microdosing is currently not legal in the United States outside of perhaps Oregon, where we will discuss later how psilocybin is administered there. Now, something you should know about psychedelic medicines is that 5 different therapies have been granted breakthrough therapy designation by the FDA. What does that mean? Well, from the FDA's own website, they say that breakthrough therapy designation is a process designed to expedite the development and review of drugs that are intended to treat a serious condition and where preliminary clinical evidence indicates that the drug may demonstrate substantial improvement over available therapy on a clinically significant endpoint. In the world of psychedelics, we have the following 5 breakthrough therapy designations. And by the way, let me clarify that for this designation, you have to have both the substance and the condition that it is treating. So we have MDMA for treating PTSD, psilocybin for treating treatment-resistant depression, psilocybin for treating major depressive disorder, a psilocybin analog for treating major depressive disorder, and LSD for generalized anxiety disorder. All have been given breakthrough therapy designation. Now let's get to the research results for some psychedelic medicine. Let's start with the current legal option, which is ketamine. Ketamine was FDA approved as an anesthetic back in 1970. That's why it's widely available legally here in the US. However, if you're using ketamine to treat depression or other issues that are not using its anesthetic properties, It's generally what we're calling off-label use. When the FDA approves something, they approve it for a certain use, and that is what is going to be on the FDA-approved label. But since it is approved for use, then you can use it for other things, and that is what's referred to as off-label use. However, there is one on-label use of ketamine, and it is a form of ketamine called S-ketamine, and that has been FDA approved for treatment-resistant depression. That is a nasal spray. Now, ketamine is not exactly like the other psychedelics. As opposed to a classical traditional psychedelic that produces a hallucinatory state, ketamine produces more of a dissociative state. Now, one of the most exciting findings about ketamine is that it is effective when a patient is acutely suicidal. Now, if you think about the current options, if somebody is acutely suicidal and they go to their physician and they're not already on a medicine, they may be started on an antidepressant, which could take up to 6 weeks to work. Now, with patients who are acutely suicidal, we probably don't want to wait 6 weeks for something to work. Wouldn't it be nice if we had something that worked much faster? Well, we do. It's ketamine. One of the most recent studies on ketamine's effect on those who are acutely suicidal showed that 2 40-minute intravenous ketamine infusions, one at baseline and one at 24 hours, after that administration, 63% reached full remission of their suicidal ideas by the 3rd day. That means those who were actively suicidal, 63% of them on day 3 no longer were having these suicidal thoughts. This is really impressive, really important. That's almost 2/3 of the patients no longer were suicidal after 3 days, compared to the 6 weeks we were talking about a minute ago. Ketamine has also been found to be effective for treatment-resistant depression. One study showed that even the most treatment-resistant patients may benefit from ketamine. For depression, ketamine is most often administered as a series of 6 infusions or injections or nasal administrations over a 2 to 3 week period. And then the patients are very often good for a while, and then they might have to have a session or 2 as a booster in a couple of months or perhaps a year later. In the same study, it showed that repeat ketamine treatments retain their effectiveness in many treatment-resistant cases, if not most. Now, this is impressive because by the name, you can already tell that treatment-resistant depression patients have tried a lot of things. So after failing a number of antidepressants, they're labeled treatment-resistant, and they go and they take the ketamine therapy, and they're finally finding relief in a lot of cases. Ketamine has also been shown to be effective in complex regional pain syndrome, otherwise known as CRPS. If you've heard of CRPS or know somebody with it, it is an extremely painful condition without a lot of good treatments. However, when patients in this study were given a 4.2-day intravenous infusion of low-dose ketamine versus placebo, the patients with CRPS who had severe pain at baseline, those who received the multiple-day ketamine infusion had significant relief of their pain. Ketamine has also been shown to be effective in addressing post-traumatic stress disorder. In one study, individuals with chronic PTSD received either 6 infusions of ketamine or infusions of midazolam, which is a psychoactive placebo, over 2 weeks. The ketamine group showed significantly greater improvement in scores for both PTSD and depression than those who were on the placebo. In fact, 67% of the ketamine group responded. They were treatment responders. They got better compared to only 20% of the placebo. 67%, that's 2/3. And PTSD, like CRPS, is something that has been traditionally very difficult to treat. So this is really exciting when we get this kind of treatment response. Now we're going to discuss the first medicine that is in the pipeline to be FDA approved, and this is MDMA. Now, if you haven't heard the term MDMA, you may have heard the terms ecstasy or Molly or E. Now, those who have been doing the studies with MDMA have been studying it for PTSD, and they have submitted to the FDA a new drug application, and we are supposed to know the results by August 2024. MDMA is not a hallucinogenic medicine. It is more of an empathy-inducing medicine. Sometimes they call it an empathogen. And what it does is it reduces activity in the fear and anxiety-producing parts of our brain called the amygdala and the insula. So when a patient is undergoing MDMA-assisted therapy, they take the MDMA in order to go back and often re-examine the trauma that is causing their post-traumatic stress disorder, but they're doing so with the fear center of the brain turned way down so that they can see it through a different lens and then re-imprinted on their brain without the fear attached to it. In the phase 3 study that has led to MDMA being submitted to the FDA for approval, 71.2% of the participants with PTSD who were in the MDMA-assisted therapy group no longer met criteria for PTSD by the end of the study. So just to clarify what this means, patients in the trial had some psychotherapy at the beginning, then they had 2 or 3 sessions of MDMA, and there was some psychotherapy in between those sessions, and then they had some psychotherapeutic sessions afterward. But by the end of the measured period, 71.2% no longer met criteria for PTSD. That means not that they're still on a number of medications and they're still having a lot of symptoms. This means that they no longer have a diagnosis of PTSD because their symptoms have resolved so significantly. The next psychedelic medicine we're going to discuss is psilocybin. Now, if you're not familiar with the term psilocybin, this is the active ingredient in what is very often referred to as magic mushrooms. Now, a journey or a trip with psilocybin, it typically lasts 4 to 6 hours, and it's very hallucinogenic, unlike the other two that we've discussed. If you've ever seen the image that came out of Imperial College London's studies on psilocybin, it shows how the connectivity between what your brain looks like on a placebo versus what your brain looks like on psilocybin, the difference is extreme, because with psilocybin, the amount of connectivity between different parts of your brain skyrockets compared to placebo. And that is what's responsible for things like sometimes people can smell colors or they can hear sights, and that's called synesthesia. But it's also likely responsible for the fact that psilocybin is very effective in addressing things like depression, which is very often when you have some hardwired pathways that are not working anymore. If your brain can suddenly form a lot of new pathways, this may help get out of this depressed state. One of the first things that psilocybin was studied for was end-of-life depression and anxiety. So these are patients who have a terminal illness, they're facing the end of their life, and they're feeling depressed or anxious about it. When given psilocybin, these patients showed large decreases in depressed mood and their anxiety, and increases in quality of life, life meaning, and optimism. In fact, they also had decreases in specifically death anxiety, and over 80% of them said they had moderately or greater increased well-being and life satisfaction. Another thing psilocybin has been studied for is alcohol use disorder. In one study, the percentage of heavy drinking days during 32 weeks of follow-up was significantly lower in the psilocybin group than the placebo group. Now, what is important to note about this study is that, like the MDMA study, these participants had both psilocybin and psychotherapy. Again, reinforcing that psychotherapy often plays an important role in these psychedelic therapies. Now, if you recall when we were talking about breakthrough therapies, psilocybin was given breakthrough therapy status for major depressive disorder. In one study, treatment response, meaning those who became less depressed from psilocybin, was 75%. But the even more impressive number is that 58% were in remission at 12 months. So 1 year after doing the psilocybin therapy, 58% of them no longer had a diagnosis of depression. Psilocybin has also received breakthrough therapy designation for treatment-resistant depression. Remember, we were talking about, if you recall, treatment-resistant depression is depression that has not responded to a number of antidepressants that they have tried. Psilocybin reduced depression scores significantly more than placebo over a period of 3 weeks. Another study on psilocybin for something that is definitely very difficult to treat is when they investigated psilocybin for smoking cessation. With this study, they found that after 2 to 3 sessions of psilocybin combined with cognitive behavioral therapy, or CBT, 60% of the participants were no longer smoking at 16 months. So this is over half of the participants, only having done 2 to 3 sessions one time with psilocybin and cognitive behavioral therapy, at over a year, were still smoke-free. If you know anything about smoking cessation, it is very hard to get those kinds of levels of success. So this was an incredible study. But what also came out of this study is that when they did the 1 year follow-up, 86.7% of the participants rated their psilocybin experiences. And remember, they only went to the psilocybin for smoking cessation, but 86.7% rated these experiences among the 5 most personally meaningful, spiritually significant experiences of their lives. Now, the next thing we're going to be discussing is the investigation into psilocybin for those who have bipolar type 2 with depressive episodes. Now, I want to stop here and mention that the research into psychedelics, thanks to prohibition for a number of years, is not where it could have been if it was never made illegal. And so we're still learning as we go. And for a lot of years in the beginning of this psychedelic resurgence of investigation, patients who had either schizophrenia or bipolar disorder or a first-degree relative of either of those, they were kept out of the studies because we weren't sure if something like mania was going to be spurred on by a hallucinatory experience or perhaps schizophrenia. However, now we are taking a look at the effects of psilocybin in those populations. And here's the first one that came out, is that a single dose of psilocybin in those who had treatment-resistant bipolar type 2 major depressive episodes found that after a single psilocybin session, most participants actually met remission criteria for these depressive episodes 3 weeks after their dose. Again, remission means they no longer had these episodes. Now, most remained in remission 12 weeks after their dose with no increase in mania or hypomania symptoms or suicidality, which were some of the things that people were worried about at first in this population. So this is very promising. Now, if we didn't cover a condition that you're interested in, there are so many psilocybin trials going on. Just to mention a few, we have trials that are going on regarding patients with cluster headache, migraine headache, eating disorders, OCD, opioid use disorder, frontline worker burnout, methamphetamine use disorder, and PTSD. Now let's move on to a substance that's in earlier phase trials, LSD. This you may have heard of referred to as acid. The experience with LSD, the trip or the journey, is about 6 to 15 hours, can vary widely, longer than psilocybin, and it's a very powerful hallucinogenic. And imaging has shown that in the brain, LSD has the effect of lighting up the entire brain compared to placebo, similar to what we were seeing with psilocybin. One of the main things studied with LSD is anxiety. Studies have found that while LSD may make anxiety worse in the short term, even microdose and a full dose, even though that may happen in the short term, they are finding that LSD induces long-lasting anxiolytic, which means anti-anxiety, effects. There were 2 randomized controlled trials with LSD in psychotherapy that showed persisting decreases in anxiety outcomes. And like I said, breakthrough therapy designation was just given to one of the drug manufacturers of LSD for generalized anxiety disorder. So this is definitely something to keep an eye on. Now, another medicine that is still in earlier phase trials is DMT. If you're not familiar with DMT, it's the active ingredient in ayahuasca. Now, if you are consuming it on its own and not as part of ayahuasca, the experience tends to last 15 to 20 minutes. One of the most exciting things that has been found out about DMT is that it can lead to neurogenesis. Neurogenesis is the process in the brain by which new neurons are formed. Now, what we didn't talk about in psilocybin, there was already so much to discuss, but psilocybin and other psychedelics very often promote something called neuroplasticity. And that refers to new connections being made in the brain. As I was discussing with that chart out of Imperial College London, where it shows all this increased brain connectivity, with neuroplasticity, what happens is new connections are formed, and then within a certain neuron, we might have new growth of the spines or the dendrites, all kinds of things that lead to what we refer to as the critical learning window reopening. Studies have found that period where we are like childlike, where we are able to learn things much more quickly, after that period closes as an adult, this neuroplasticity, these psychedelic that lead to neuroplasticity, can cause opening of that window again. And that's why therapy is very often so important, because when you've got that window open, that's a perfect time to learn new habits, new behaviors, new thought patterns. DMT specifically has been found to go one step further than neuroplasticity, is it promotes neurogenesis, the process in the brain by which new neurons are formed. Now, why would this be important? Think about things like stroke. A stroke is where there has been blood loss to the brain, so the area of the brain and the neurons in that area have died. What if we could give DMT to stroke patients and regrow some sections of the brain? That would be life-changing for some of these stroke patients. So in one study, DMT treatment promoted the generation of new hippocampal neurons. Hippocampus is a part of the brain, which enhanced adult neurogenesis, improves spatial learning, and memory tasks. So something definitely to keep an eye on is DMT and neurogenesis. Another medicine that is similar to DMT is 5-MeO-DMT. Now, 5-MeO-DMT is the primary psychoactive component of the secretion that comes out of a Sonoran desert toad. Wow, that's a mouthful. Just so you know, that is one way that you can get 5-MeO-DMT, but there is also a synthetic version at this point. Now, when taken on its own in the natural setting, it is generally something that is smoked, and it is another thing like DMT that is 15 to 20 minutes long for the experience. Studies into 5-MeO-DMT are newer, but a study recently came out showing that when a company made a formulation of DMT that is intranasal, so it's inhaled like a nasal spray, this showed rapid antidepressant effects in 55% of depressed patients by the day following their dosing. Now, at day 29 in this study, 55% of the patients were in remission from depression, and 45% of them were still in remission by day 85. So that's almost 3 months out. Full remission of depression from a single dose of intranasal 5-MeO-DMT, which showed that even though this has a short treatment duration and these acute effects are done within 2 hours, it has a lasting effect. Something else that is really exciting and promising, but still in earlier phase trials, is Ibogaine. Ibogaine is originated from a root in Africa. The trip is very long. It can be between 12 and 36 hours. It has a visionary phase and then an introspection phase. Something notable about Ibogaine is that it has a cardiotoxicity, meaning that it can prolong a certain interval in the rhythm of the heart. And so there has to be much care taken to ensure that patients are safe to undergo Ibogaine. But there have been a number of studies, and one of them that was recently released was Ibogaine for patients with traumatic brain injury, or TBI. Now, to help protect the heart, in this study, they gave them Ibogaine along with magnesium. And this magnesium-Ibogaine combination resulted in significant improvements in functioning in the patients with traumatic brain injury, both immediately and 1 month after treatment. Now, patients with traumatic brain injury very often have PTSD, depression, and anxiety. And in this study, significant improvements were shown in all 3 of those 1 month after treatment. The second to last psychedelic we're going to be discussing is mescaline. This is a naturally occurring psychedelic found in a number of species of cacti, including peyote and San Pedro. It has hallucinations that are similar to LSD and psilocybin with a little bit of distinction in the visual patterns and colors type things that you see. Mescaline lasts 8+ hours for its journey. There have been no published clinical trials available yet. However, studies have been started that are going to look at the effect of mescaline for those suffering from alcohol use disorder. And there is already a published study that doesn't look at a clinical trial, but it looks at what's called naturalistic use. So this is when they give a survey to a number of people who have tried a substance. So in this case, they gave an anonymous online questionnaire. 452 people responded. And of those respondents, they reported improvements in depression, anxiety, post-traumatic stress disorder, and alcohol and drug use disorders. Now, of those respondents who reported history of those conditions, 68 to 86% reported subjective improvement following their most memorable mescaline experience. And the final psychedelic we're going to discuss is ayahuasca. This is a psychoactive brew. It is like a thick tea that you drink. You may have heard about ayahuasca. It is very often administered in Amazonian territories and South America and Costa Rica and areas like that. Ayahuasca is most often administered in an ayahuasca ceremony. And these ceremonies are led by facilitators who go by a number of different names depending on the lineage that is hosting the ceremony. Now, another thing about ayahuasca that is a little different, while many of these psychedelics are administered and the patients have eye shades on and headphones and they're hearing music, in the ayahuasca ceremony, the facilitator, I'll just call them facilitator for ease here, they're very often singing songs the entire time, and the songs are to help the specific patient with what they think the patient is going through in the ceremony. Now, something else about ayahuasca you may or may not have heard is it is a purgative, meaning it generally induces a purge of some type. Now, that type could be vomiting, that type could be diarrhea, it could be urinating, sweating, shaking, many different ways of purging different energies from the body. Now, ayahuasca itself is a combination of both DMT in one of the plants and then another plant that has an inhibitor that prevents the metabolism of DMT, which is why DMT by itself is 20 minutes. But with this other combination, the trip is extended to 4 to 6 hours. Now, there are not too many placebo-controlled ayahuasca studies, but in one that I found, they observed significant antidepressant effects with ayahuasca when compared with the placebo at all time points that they measured. And over all of the studies that I've seen with ayahuasca, antidepressive effects seem to be one of the most common themes. Now, the fact that I mentioned that there are not too many placebo-controlled ayahuasca trials may make you realize, hold it, isn't it difficult to come up with a placebo when you're talking about a psychedelic? What if they definitely know they weren't taking the psychedelic? And you would be absolutely right. It is one of the bigger challenges of the psychedelic clinical trial design is figuring out what can we use as a placebo. So they have used different things from, as I mentioned in the ketamine, they infuse midazolam, which is another medicine that is psychoactive, so they would still feel something happening. Maybe they give niacin, which would cause some flushing. They might give Benadryl, which makes people sleepy. But just something to keep in mind that if we've got any budding scientists out there who want to contribute to the psychedelic science industry, we're always interested in discussing more ideas about how to come up with effective placebos. Now, you may be wondering, outside of ketamine, which is legal everywhere in the United States, where can I access these psychedelic medicines? Well, the one place you can access psilocybin, again, remember the ingredient that's in magic mushrooms, is the state of Oregon. The state of Oregon passed a measure in 2020 that led to the formation of a monitored, regulated adult use model. That means that adults in the state of Oregon can go to a licensed facility, be seen by a licensed facilitator. They are given a very controlled drug, psilocybin, made by a licensed grower and tested by a licensed testing facility. You see how many places that I had to license in this? That's how well controlled this is. Now, following Oregon's launch of the psilocybin program, the state of Colorado decided to follow suit, and they voted for a similar measure, which is going to allow for a regulated adult use model of psilocybin first, likely to start in 2025. And then if that is a success, they may move on to other natural substances being able to be available in that same regulated format. Now, outside of those two legal modalities, we have something called decriminalization, and it's spreading. Now, decriminalization is different from something being legal. If something is legal, it can be regulated, it can be bought and sold, it can be taxed, all of those things. With decriminalization, it's different. This doesn't mean that it's legal. You cannot buy or sell it. It just means that if you're caught with it, that there are likely low to no legal penalties for that. And decriminalization of at least psilocybin and often more things is spreading and is already in place in states like Colorado and in cities like Washington, D.C., Seattle, Washington, Denver, Colorado, Oakland, California, Detroit, Michigan, just to name a few. Some of the next steps after researching these psychedelics is getting them into the mainstream medical system. We have to educate our providers on psychedelics, which is what the Psychedelic Medicine Association does. We have to educate patients. We have to accredit training programs and get a licensing exam. We have to get insurance to cover it. And we have to figure out in our medical system who is going to do what in this new paradigm. But this is a very exciting time. I want to thank you so much for checking out this video and learning more about psychedelics. If you want to continue your learning, you can visit us at the Psychedelic Medicine Association, which you can find at psychedelicmedicineassociation.org. You can also find us on Instagram at Psychedelic Medicine Association, and you can check out my podcast, the Psychedelic Medicine Podcast, which is on all podcast platforms and Instagram. Thanks so much.
Welcome to Root the Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.